Good afternoon, ladies and gentlemen. Welcome to this segment of Medpodcast, your gateway to the latest medical trends and updates. Today, we are so pleased to have Dr. Mohammad AlSayegh, an interventional radiologist. Welcome, Dr. Mohammed.
Thank you very much.
Dr. Mohammed, I know this was a very quick introduction, but as we have discussed the interventional radiologist and the procedures you are doing as an expert in this field in the last two episodes, today we are so pleased to have you again to discuss the interventional radiology from the patient perspective, if you don't mind.
Yes, so patients usually ask and think a lot
Hmm.
about needle size,
Yeah.
how big is the needle going into my back or my neck?
Hmm.
It's not usually the length of the needle, it's the girth of the needle, how thick the needle is
Hmm.
that causes pain. Usually, we don't give a lot of sedation, a lot of intravenous fluids or medication
Hmm.
to let the patient sleep for the procedure. Usually, it's only local anesthesia,
Yeah.
so the patient is awake and with us throughout the procedure, unless the patient has a lot of anxiety.
Mm.
Prepping for the procedure. Patients usually don't need to fast. I like patients having their meals within 2 hours before the procedure,
Hmm.
just not to have low blood sugars during the procedure. Pain sometimes causes low
No.
blood sugar,
Yeah.
You don't want them to faint.
Mm.
So, another thing is having the patient know about the procedure, what we're going to do from the time the patient comes into the room. Once the patient goes into the room, they change their clothes because we need a lot of betadine, which stains the clothes.
Hmm.
So the patients have to wear their garments. Once they go in, they lay on the position on the table to the position we need. Usually it's a prone position, so face down, and patients don't like having their face down. They're not seeing the doctor. So
Yeah.
that's why we talk a lot
Mm.
throughout the procedure. So we inform the patients what we're going to do step by step. Now the betadine is going to be on your back. You're going to feel a little cold. And now we're going to put the dressing around the site of surgery. We're just going to let the site of puncture exposed. The next step is that we're gonna give a small pinch of local anesthesia. It's gonna burn a little. We wait for about 90 seconds to get numbness of the area, and then we position the C arm. The C arm is the tool of radiology that we usually use to see the spine itself. Once we get the correct position, we start taking images. Once we take our images, we know exactly where the puncture site should be. Having the puncture site is usually a single or a double puncture. Once we reach the correct structure, be it a nerve or a joint, we either deliver medication. The patient usually feels a little dullness at the site of injection. Some people say, I feel a little heaviness
Hmm.
at the site of injection, and after which we deliver a small amount of contrast. Contrast is what helps us make sure that we are in the right position,
Hmm.
be it a nerve or a facet joint or a sacroiliac joint. After delivering contrast, we take another image, clarifying the structures that we need to inject or ablate using the radiofrequency device. After we either inject or deliver the radio frequency waves, we take another image. Usually, our images are orthogonal, which means 90 degrees apart,
Hmm.
because we want to know how deep we are in the other image. Once we get the procedure done, we remove our needles. We cover the site of injection by dressing. The patient goes back to recovery, waits for an hour, after which he can go back home.
Okay, now the question is, after you have explained everything very easily and made it easy for everyone and also clear, how long does that procedure take?
Usually for an epidural injection or a transforaminal injection, which is near the nerve, it takes about 5 minutes.
Only
Uh,
5 minutes.
only 5 minutes. I know the explanation is long, but the
Yeah.
procedure is pretty
I
short.
was expecting you would say like 1 hour or 1 hour and a half.
Yeah, but once we're doing radiofrequency ablations, usually takes about 15 minutes to 30 minutes because we usually do our radiofrequency ablations at 3 different sites,
Mm-hmm.
and getting the correct image usually takes a little time.
Mm-hmm.
Once we do get our correct position, delivering the radio frequency takes about 1 minute and 15 seconds up to 2 minutes per site.
Mm-hmm.
So that consumes about 6 minutes, and after which we're done.
Okay.
Uh,
That if we say that your procedure is going structural.
Very
So
true.
from your experience as an expert in this field, like since years, I don't know, I don't want to say how many years,
Yeah.
but as an expert in this field, what is the longest procedure you have done before?
Longest procedures, I would say a sympathetic block. Sympathetic blocks are not the usual.
Mm-hmm.
The bread and butter is the epidurals, but sympathetic blocks is going anterior or in front of the vertebrae.
Mm-hmm.
We have some very small nerves there. It's a chain of nerves extending from the neck until the pelvis.
Mm-hmm.
So, reaching these nerves, you would have to avoid a lot of structures. So, you have to be very delicate. The aorta, which is the main artery pumping blood, is very near to you.
Mm-hmm.
The kidney is near to you. The liver, the bowel is near to you. Usually, I prefer doing them CT guided so I can see all of the important structures, just avoiding them, going around them. We're talking about 45 minutes.
45 minutes, that's the maximum.
Yes.
Now, if you say about taking images, most
Hmm.
people think that you cannot make that procedure in, let's say, live scanning. Do you have any way to see, let's say, in the same time or a real time watching inside the patient?
Not watching inside the patient, but looking at where my needles go
Mm-hmm.
using the radiology imaging. There are techniques, but they're not being done by interventional radiologists like epidural cameras.
Mm-hmm.
They are available with our other specialties.
No, I mean even from outside, if you are using the ultrasound, that gives you, is that giving you like a real time watching?
Yes, so using either ultrasound or fluoroscopy imaging, which is the video of the X-ray, it is real time, so you can actually scan continuously
Mm-hmm.
using ultrasound without radiation,
Mm-hmm.
and you can actually see the medication being delivered into, let's say, a sacroiliac joint or into an epidural space. And then when you're talking about fluoroscopy, you can actually see your contrast going into the epidural space or going into the sacroiliac joint.
Okay, that's very great. Dr. Mohammed, as an end to our three segments that we had before,
Mhm.
I'm surely that you have a successful story of our patients that have done a procedure and was very happy for it. Could you please share us one of your experiences you have done before?
Yes, so I've had a patient that used to have shoulder pain
Hmm.
for the last 15 years.
15 years.
Yes, 15 years. This patient was diagnosed by multiple physicians
Mm-hmm.
and by MRI that he had shoulder tendinitis with some tears. He had surgeries for his shoulder for about 3 times,
Mm-hmm.
two being in the country and one being abroad, with no improvement. Once I've seen that patient, I considered that the pain would come through a nerve and not through the shoulder joint itself. So we imaged the neck and we saw that there was a disc compressing the nerve that supplies the shoulder, which is C5, C6.
Mm-hmm.
This disc was approached by interventional radiology. So we went in using fluoroscopy, which is the video of the X-ray. We reached the nerve and we did a nerve block there. The patient had pain relief for the first time in 15 years, and he was really happy. Follow up after 6 months. The patient was pain-free, and imaging of the disc was done again as requested by the patient, and the disc shrunk in size.
by
So,
itself.
yeah,
Yeah.
so the patient was pain-free for life.
So instead of having three procedures, as you have mentioned, he only have done a small procedure, let's say a minimally invasive one, and then have the pain gone away.
Exactly, and
That's,
that was only 15 minutes.
I think you have magic hands.
Thank you very
Thank you
much.
very
I
much.
hope.
So for the last three episodes, or for the last two episodes, I have said always Dr. Mohammad AlSayegh, but this time I'm going to end up our segments, our great speech with you with Dr. Mohammad, the Goldsmith. We are so happy to have you in our program.
Thank you very much. Thank you again
Thank
for
you so much.
highlighting interventional radiology.
Thank you so much. Our dear viewers, we have reached to our end of our segments with Dr. Mohammad AlSayegh, or as I have said, Dr. Mohammad Goldsmith. Hopefully, we can meet you again with another medical specialist. Until that time, see you later.